All right. Hi, this is Dr. K. And tonight I have called my good friend Deneen Lewis, who's in the ATL, because it's Heart Health Month and she's a wonderful nurse. And I want to talk to her about heart health. And we're just checking in with each other to see how's it going. Deneen,
Have-
welcome to the show. And it's been a long time since we had a chance to wrap. So, what's the update for Heart Health Month?
Well, hello, and it's so good to see you and hear you again.
Girl.
Hey. um, so I do want to tell you that I have had some events over the past 6 or 7 months, and as well as you know me, apparently I now have been diagnosed with coronary artery disease.
Coronary artery disease. This is
Yes.
supposed to be a heart health awareness month talk, and you telling me that you are aware that you have coronary artery disease.
Yep. So, um,
Oh,
yes.
wait, let me process that for a minute. Denise, what does that mean?
Well, it means that I have had a cardiac cath, and apparently I had two, not one, but two blockages in my right coronary artery. And now I have two um, stents that have been placed into my right coronary artery. One
Hey,
blockage.
stop the press, stop the press. I have to digest this. Now, one is you met me in residency. And I was a struggling resident. That's just all we can say. And two was a ER nurse,
Yeah.
mom of three, and
Mhm.
wife, healthy, and you were working in one of the busiest ERs in America, not just in Atlanta, in America. Okay, you
Mhm.
were ER nurse at Grady Memorial Hospital, where it's
Yeah.
always crack a lacking. Okay,
Yes. Level 1 trauma center.
that's what it is. You
Yes.
are still a nurse, and
Yes.
excuse me, but a critical care nurse,
Yes. Mhm.
mom of three, grandmother of
Mhm. Two.
two.
Mhm.
Still, we got Kenny. Kenny still. Where's Kenny? That's
He's still here.
uh,
Still a wife.
married forever. Oh,
Yes.
wait a minute.
35 years.
How many?
35.
35.
Mhm.
And let me just also add that you have served your country.
Yes, I am a veteran.
You are a veteran,
I am.
and you are now at the
The
Veterans Hospital.
VA.
Another place that's always crack-a-lacking.
Yeah. Yes.
And so, did coronary artery disease sneak up on you?
It did. It totally snuck up on me. Um because I I realized I was having some symptoms, but like a lot of nurses will sometimes do, we keep it pushing.
Is it nurses or you? Now, wait a minute. You are, like I said, now we done went over the whole gamut.
Mhm.
You have a military background.
Yeah.
You are not supposed to be crying, boohoo, and moaning. You are a wife,
Mhm.
are a mother.
Mhm.
You then also are a caregiver and a professional nurse, old school nurse. Because how long you been
Mhm.
a nurse?
About 34 years.
And you say that coronary artery disease snuck up on you.
It snuck up on me. It snuck up on me because all of those things that, yes, I am. I think that women, and I'm just going to say, in my opinion, especially Black women in my age range, I am 57 years old, will be 58 this year. And,
Don't do
um,
that, girl. It's all right.
and, I think we were taught when we're growing up, keep it pushing. Keep it
Okay.
pushing. Um, you have to work hard. You have to be twice as good as your counterpart to get half of what your counterpart may have. And so, we keep it pushing. We may have some things, some symptoms. We take an ibuprofen and we get up the next morning and we keep it pushing.
Okay, I'm gonna buy that. I'm gonna give you that, and
Mhm.
I'll buy that. But let's talk about what are you pushing, because we always talk about chest pain. You gotta help me understand how someone in the medical field, you say it snuck up on you. Tell me, like, how did this present? Because everyone says, did you get the crushing chest pain?
So for me, um, and maybe a lot of women, it's a lot different. No, I did not have crushing chest pain. Um, I had what I even call today, even now, I find it hard to say I have chest pain. But as I look back, I had a mild chest discomfort every now and then that I really just kind of put it off and said, okay, this is indigestion.
Mm-hmm.
I would take something for antacid.
Mm-hmm.
It would go away eventually, and I kept it pushing. It was never bad on a scale of what we like to say, 0 to 10, with 10 being the highest. I would always rate that pain at about maybe a 3.
Do you think that, oh, do you have chest pain is a stupid question then? Because I'm I'm the doctor that's walking to you and saying, do you have chest pain?
Yeah.
Uh, and you tell me it's a 3, and I'll say, okay.
hmm I think it is not. I don't think it's a good question, a fair question. I think we really need to ask more about, are you having any discomfort, any chest discomfort? Because I will tell you, even now, I still can't seem to call it chest pain.
Okay, and that's okay. So the question is, so how long ago, you said 7 months you've been dealing with this?
Yes, about 7 months.
Okay, so take me to when, how do we get from I'm pushing it to laying on the table getting a cardiac catheterization? Tell me, what was the trajectory to that? You saw a doctor, you have access to doctors.
Yes, I have access to doctors. But before that, just besides the chest discomfort, um, for about the past year, I did have some symptoms with really, really, really bad headaches. But my job, I um, have an extremely stressful job. And again, take a Motrin, keep it pushing. But I had really bad headaches, so much so that I normalized my headaches. A headache every day was not unusual for me. So it became, oh, okay, this is my normal headache. Things are just getting to me. Let me take some Motrin and let me keep pushing. I take the Motrin, my headache would get better.
What about, are you on blood pressure medicine?
I was not on any blood pressure medicine. I am now also diagnosed as hypertensive.
Okay,
So
so
now,
wait, hold up now.
mhm,
So you have not, at up to 57, not been diagnosed with hypertension.
no, no. And mind you, yes, I do go to my doctor, and usually I'm there quarterly, like at least about every 3 months, just to get a refill on medications. And every time I went to the doctor, my blood pressure was not it wasn't high. There were a couple of times it was mildly elevated, and at that time, um, we related that to my headaches because I was having headaches. I had migraines. And so my doctor will say, "Oh, it's your headache that's making your blood pressure a little bit high." And what I mean by a little bit high, I may have been like systolic 140s, diastolic 90s. That's where it was.
But Deneen, and I'm going to say this,
Mhm.
and I don't think it's the fault of your doctor. I think that we have been, what I'm finding is that in the literature, it supports the fact that there's a delay in diagnosing high blood pressure in Black patients for almost 3 to 5 years,
Mhm,
that we present numerous times to a healthcare facility or professional, and our blood pressure is undertreated
mhm,
or it is dismissed.
mhm,
And there's a delay in starting it. And we have the information that Black folk have high blood pressure
mhm,
at higher rates, or at the highest rates.
mhm,
However, it continues. You're not the only person who said, "Oh, it's not high blood pressure,"
mhm.
and and I know that you have a walking program, and you have a job that is physically demanding, meaning that you don't have a desk job. Am I correct?
Well, it, um, pretty much now it is a
Now,
I'm always in meetings. So
mm,
yes, which is gonna lead to my other symptom that I
okay,
was having that I also normalized over the past couple of years. So with the headaches, normalize that. Stress. I have a lot of stress. It's the headaches from that. I also within the last year start having um feet and ankle swelling. Now, I did see my doctor, but again, normalize that. I would come home in the daytime. I'm in meetings all day. I'm sitting,
hmm
I'm sitting, I'm sitting.
hmm
Um, I come home, my feet are swollen. I put them up, go to bed. Next morning, they're back down. They're fine. So I think, okay, it's just that sedentary lifestyle at work. I'm sitting in meetings all day, then I'm sitting at my desk, for the rest of the day, and I'm usually doing that about 10 to 12 hours a day.
okay,
Yeah.
okay. So my question is, you're normalizing that. What did your doctor say?
And normalized it. Did give me just a little bit of hydrochlorothiazide, 12.5. Oh, it's you're sitting down, you gotta get up a little bit more, you gotta walk more. I did get what we call a sit to stand desk, so I could stand up some more. But again, and then I wasn't following up because I didn't have a lot of time to follow up. It
Okay.
goes down at night, I'm fine. So I wasn't running to the doctor, um, all the time, and again, there's a lot of things playing against this, right? Because,
hmm
I I'm a nurse. We don't we don't wanna be that patient.
You don't want to be that patient.
We
Okay,
don't wanna be that patient that just
we
yeah.
we're not going to cut to the chase. So now you're that patient, and you are that patient that does not want to listen, and you're helping us with your symptoms and saying, "I'm fine." So when did you not become fine?
Well, so I had a syncopal episode. I was at I was getting my eyebrows
You
done.
see this face? You see this face?
Uh,
What?
uh-huh. Yeah, passed out. For me, again, I'm 57-year-old, so I've been having hot flashes. Sometimes you get that hot flash from hell. I mean, you get them. It's normal. Normalizing. It's normal to get hot flashes at
And
different.
faint. Hot flash is going to lead to fainting?
Well, that only one time. Yeah, I it happened one time. It happened one time. And again, I don't know if it's
You're killing
that
me. You're
that
killing me.
woman, that Black
Yes.
woman.
You're giving me chest pain right now, Denise. You giving me chest pain.
When I tell you, was like a hot flash from hell pretty much, and all of a sudden, and I remember her, I was fanning myself and she was fanning me, and then the next thing I remember is, "Okay, I feel better now." And I was like, "Oh, it feels really cool. Oh, that feels good on my back." And I'm going, "What is that on my back?" Feels like I'm on the floor. "Deneen, are you on the floor?" My eyes was closed, and it was like, "Open your darn eyes, look and see what's going on." I open my eyes and I see all these people over me, and they're calling 911, and they're like, "Oh, I'm calling 911." And I'm going, "Who are you calling 911 for?" And they're like, "You passed out." I tried to catch you and I'm going, "Oh, are you okay? Oh no, I'm fine. Are you okay? You guys calm down. It's okay. It's okay. I'm a nurse. It's okay. I'm okay, really. Just got a little bit overheated."
And did you get off that floor or did you go to the hospital?
I got off the floor. I talked to EMS, to 911, told them I was fine. I'm going to wait. I'm having some water.
And I'm Denise,
There was no other
Denise
symptoms.
nurse.
Yeah, I'm not hypertensive. I don't take any medication. And so, no, they did not send the squad. I'm like, I don't need a squad. You don't need to send it. I'm fine. I know that if I'm not, I know what to do. It will be okay. And I took about another 30, 45 minutes, drank some water, and felt better. Then I drove myself home.
Mm.
I did.
Yeah, okay. And when do we get to the doctor, please?
I get
Doctor
home.
that can tell you that you are sick and that you need help and you're not getting ready to discharge yourself, cancel any requests for help. When do we get there? And where's Kenny? Kenny,
So I I get home and my daughters, love my daughters, my
I
daughters,
know you love them.
all 3 of them on the phone with me, they're
Line them up.
fussing at me.
Line them up.
Yeah, they're my oldest, which is Kendra,
Yes, we know.
and my middle, Kiera, and then also my, baby, who is Kayla. And Kayla is now in nursing school.
Mhm.
Bless her heart. So as soon as I get home, she's like, "Mom, I gotta take your blood pressure. I gotta take your blood pressure." And I'm like, "Okay, take my blood pressure." She takes it. It's 172 over 116. I said, "Clearly, you're just a student and you don't quite know what you're doing yet,
You a mess.
baby. But that's not my blood pressure because my blood pressure is not that high." We get the automatic machine and then we take it and it's still 170s, 114. And then I'm going, when is the last time we changed the batteries in this? Because something's wrong with this machine. My daughter, my oldest daughter, is like, "Dad, this is Kenny." He's like, "Take her to the ER now. We
Now.
don't care what she says." Okay, okay, I'll go to the ER. I go to the ER, check in, and they do, your vitals. They draw labs, they get an EKG, all of that. I sit down in a waiting room. It's full. I'm an ED nurse. It's full. And I'm looking around at all of the patients here. It's been about an hour or two, and I'm like, let me go to my chart, create an account so I can pull up my labs. I can pull up my EKG, and I just want to see what my EKG and my labs were. I did. It was all normal. A little bit dehydrated, nothing big, mildly dehydrated. I can handle that. I can fix that. I'm looking, about another half an hour goes by, and I'm looking at one patient. It looks like this patient over here has COVID. This one over here look like he's got monkeypox. I'm like, yeah. So here's what we're gonna do.
Mm.
I'm a little dehydrated. My EKG is fine. There's no ST elevation or anything like that. So I'm gonna go ahead and leave because there's too many people here. And I'm gonna go hydrate myself. And I feel better. I'm gonna take my Motrin for my headache. That's gonna make my blood pressure go down because it's my headache. I'm stressed, and we're going to do that. And I'm going to hydrate myself. And that's what I did. And I left.
The
And
ER.
I left the ER. Yeah. A couple of days I'm at home, back at work. I did tell my boss about this, who's another long-term nurse and everything. And she's like, yeah, but you're holding your head. And I'm like, yeah, because it's my headache. I have these every day. So they send me to the ER in my facility where I work at. Again, they're looking at migraines. They did a head CT scan.
Let,
Everything's
let,
good.
let me help you. Let me stop you here. When did you see a neurologist for your migraines?
I saw them on the second visit to the ED in my
No,
facility.
no, no. You said you had long-term migraines. Who diagnosed you with migraines, my friend?
My primary care doctor.
When did you get a formal diagnosis of migraines? Because you know that's a neurological problem, right? That's not a
It
headache.
is.
You keep
It
telling me migraines.
it is. It is.
You know, I was a resident. You know what I'm saying? When we
You were?
okay,
Yeah.
uh-huh.
Yeah.
Not a lazy one, by the way. So let me help you. And in one of the busiest ERs in the United States. That's what we meant. So
Mhm.
you were never formally diagnosed with migraines. You were
No.
told you have them. You don't even have a prescription for migraines. You've been taking Motrins.
Well, actually, my primary care was giving me, oh my goodness,
Something?
I cannot think of what it was.
Okay. Okay.
He tried a couple of different migraine medications that
Did it work?
really didn't work.
Uh-huh. So
Um,
clearly you didn't have
but
migraines.
the one, what is that called? I can't think of what it's called right now.
You were Triptin or something like that.
No, the old one, the old one.
Okay. Okay. Bottom line is, it didn't work. You still have
Mhm.
had having headaches, and you continued with that diagnosis. But we in the ER now.
They're treating me. They're thinking about migraines. I see a neurologist in my facility.
Okay.
My facility where I work at um, actually talked about my sleep, and they referred me to the sleep clinic. And I'm going, sleep clinic? I don't need to go to sleep clinic. I don't have sleep apnea. Well, you might be, let's just get a study and see. So that's what they did on that part. And I did that from my work. But then also, I went back to my primary care, who at this time is I have a nurse practitioner that
Mhm.
also works with my primary care and physician. And she saw me and she goes, "Yeah, so Denise, I'm going to send you to cardiology." I'm
Mhm.
going, cardiology? I don't need a cardiology referral. Just give me a little bit of blood pressure medication. It'll be fine. And she's like, oh, yeah, I'm going to put you on some blood pressure medication. And I want you back in 2 weeks. And I took it. I
Mhm.
agreed. I took it. I came back. Blood pressure was fine. My pulse was high, stayed at 100s and above. Sitting down talking to you, my pulse would be, 105, 110, something like
Mhm.
that.
Mhm. Mhm.
And then I told her, I said, well, my blood pressure is doing good. So I think I probably just need a beta blocker. Maybe we need to do that because my and she goes and she says, yeah, you may, but let me get a thyroid. And I'm like, thyroid? Nothing's wrong with my thyroid. My thyroid is fine. And she said, that's okay. We're gonna rule it out. And that's when she wanted me to go to cardiology. I said, okay, went to the cardiologist. The
All of the day. So you saw a nurse practitioner,
Mhm.
and then she referred you to the cardiologist.
Cardiologist.
Okay. All right.
Went to the cardiologist, told him this whole story. And let me just tell you, my cardiologist kind of thought that my syncopal episode
Mhm.
was probably some little vasovagal thing. He did not, because my presentation
Of
of
course.
what he saw and didn't have high blood pressure before. And yes, my blood pressure was high now, but it was controlled because she put me on some medication.
Oh, when?
My NP put me on the blood pressure medicine
When?
when I after the syncopal episode
What did you get
when
on?
yeah, I was on I can't I was on
You see this face.
Norvasc. She
So
put
you
me
got
like
put
on
on Norvasc.
yeah,
Okay.
she put me on 5 of Norvasc and blood pressure came down. No more 170s.
Okay.
But again, I told
Your
you
heart
my
rate went up. Your
heart rate went up.
crazy. Okay.
And she couldn't figure out. She's like, no, we're going to go to the cardiologist. So it just so happened when I went to the cardiologist that day, I promise you my heart rate stayed above 100.
Mhm.
That day in the office, it was like 94. So I wasn't tacky. And he's like, well, you're only, 94, and here you go. Your nerves, y'all think, he was like, I really don't think this is, you're not tacky. And I said, I promise you.
94. Okay.
Yeah, I said, I promise you, I have an Apple Watch. I look at it all day. I check it. It's been high. And he said, well, I tell you what, let's put a Holter monitor on you for 2 weeks. And
Mm-hmm.
I said, 2 weeks? I can't wear that for 2 weeks.
Girl, you got a problem with everybody. Okay. Like I said, okay. Did you get the Holter monitor?
So he agreed not to do the Holter monitor. He said, I tell you what, Deneen, here's what we're going to do. Let's get an echo, and I can get that done today.
Right
So
now.
I'm like, echo? Cool. Let's go do that. I can do an echo. So we go do the echo. And after the echo, I go back into his office, and he comes to me. He says, Deneen, he said, we got a problem.
Uh-huh.
And I'm like, what you mean we got a problem? What kind of problem? He said, your EF is 35.
Your ejection fraction of your heart is
Mhm.
35 and normal is
And normal would be 50 to
55.
70. Somewhere they a little bit different, but over 50,
55.
50 to
Oh, 50, yeah.
70. Mhm.
We like to see 55. That's
Okay.
the number. And you
Mhm.
don't have that.
And I don't have that. I have 35.
And you are in congestive heart failure.
And that's perfect. And we didn't know why. And so at this point, he says to me, so here's what we're going to do. You're going to go in there and you're going to get this Holter monitor and you're going to wear it for the next 2 weeks.
Mm-hmm.
And then I'm going to schedule you for a heart cath. I said, wait a minute, aren't you moving a little too fast? A cath?
No,
Who, me?
we late. We
He's
late.
like, your EF is 35. And I said, yeah, but I can't figure out why I exercise. I walk up hills, up and down hills,
I
um,
know.
3 days a week.
Mm-hmm.
When I'm walking up these hills,
Mm-hmm.
I don't have any chest pain. I don't have shortness of breath. I mean, you get a little tired because it's uphill. I don't stop. I'm doing this. I can't have heart failure. Not not me. I can't. But I eh, I said, okay, I'm gonna be a good patient.
Mm-hmm.
And I'm gonna listen and I'll go ahead and we'll schedule the heart cath with a Holter monitor for 2 weeks. And it wasn't until I was on the table. I was directing everything because I'm looking at people and I'm like, okay, you need to make sure this, you need to make sure that. And they're like, Miss,
Yes, you're gonna be a patient today. I
yeah,
tell
they're like,
I tell my you get to relax today. We're gonna take care of you. I know it's hard. I get it because
yeah,
I've done the same thing.
mhm.
Someone laughed at me and I said, I know it's so bad.
They
But we
should have gave me some more sedation, but anyway, it wasn't enough. Whatever they gave me was not enough. But it wasn't until I was on the table, and mind you, because I work with these people, I've worked
yes.
with the service, the cardiology
Team.
team.
You're interventional
I
cardiologist.
have a little rapport relationship with them. And he says to me, the cardiologist that's cathing me, finally, he goes, Deneen, you got a block, you have two blockages. And I'm like, what? He says, yeah, 90% in your right AC.
Oh my
I'm
Lord.
trying to get up and look, and I'm like, what? And then they're like holding me down, and I'm like, oh, okay, 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 okay. Yeah, with the
Yeah, not enough sedation.
sheath in
Okay.
and everything. But it was at that moment when I realized, oh crap, okay. And I just laid down, closed my eyes, and I started talking to God. And I was like, Lord, please help these people do what they need to do. Because
Mhm.
he says, don't worry. I'm going to see if I can take care of this. We're going to put some stents in here. Just let me take care of you. And so I was like, God, please help them to take care of me.
Now I need a minute.
Yes.
Okay, I have my minute. So you get in the cath. Um, yeah.
Yeah.
That's upsetting. How the girls and Kenny doing?
They are much better now. They're better now. I still had, there's a lot you have to adjust to, especially going from someone who didn't take medications. I mean, other than Motrin, because Motrin is our friend
Mhm.
for pain, and taking um I've been on Ambien for years because
Because
I
you have
don't
to sleep. Mhm.
because I yeah, and don't sleep. And then I did have my sleep study, and come to find out they're actually ordering me a CPAP machine because yeah, I stopped breathing at night. And
You snore? You've been
be,
snoring for years.
I do not snore, and that's the issue. I don't, and I kept saying,
Snored.
I don't snore, but I am a side sleeper and a stomach. I sleep on my stomach. But the reason why is because if I'm on my back, I can't breathe. If I'm on my back, I would snore, but
Mhm.
I really sleep on my side and on my stomach.
Mhm.
And it's also been found that sleep apnea also has been tied to hypertension and heart disease, because when you stop sleeping, there are these stress hormones that are released, and that does like just everything. And so it all really started to hit me.
But let
And
me say this, Denise. Let me say, you had untreated hypertensive disease for years,
mm-hmm,
and you can develop sleep apnea at any point. Don't get me wrong.
mm-hmm,
But the pathophysiology for you, the pathway, was that for many, many years, and this is the same thing that I'm finding with other Black patients, and even going back to look at the studies, this late presentation of advanced hypertensive disease.
mm-hmm.
Your cholesterol level is what?
Cholesterol was not bad. There was a few years ago when my LDL was, maybe like right at 190.
So we on the higher side, and the
We
other.
we were on the higher side, and my doctor wanted to he said, well, let's do some statin. And I'm like, no, 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 no. Let me
Diet.
let me do
Mhm.
diet and exercise. Which now it's 130s.
Okay, but let
One
me ask you this: Did you ever get a cardiac calcium test done?
No,
Never, because
no.
I've had two of those. One when they first came out, because I worked in the ERs, and they were like, "Oh, let's try it." I was at Lubbock Heart Hospital, and recently had one as well. So you didn't have a calcium score, which we're doing now, which patients need to understand. Part of your workup and just heart health is to get a calcium score.
Mhm,
That can be done. And
mhm,
it's not completely covered by insurance, which I think is a little tricky, because
mm,
the patients that need it the most may not have like the $80
mhm,
that you can get to um to have it done. So the insurance is not going to cover it 100%. But let's just be clear that there has been long-standing hypertensive disease
mhm.
that was untreated. The other thing is, after the cath, you still are left with, now they got the blockage, right? The two
Right.
blocks they put stents in.
Right.
And do you know what kind of stents you had?
Um, they're both drug-eluting,
Hmm.
um, Medtronics. Yeah.
Okay, so and this is why I'm asking you, because you can answer that off the bat. The
Yeah.
patients
But
need to understand what kind of
yeah.
stents you have, and then now but you're still left with a heart, the diagnosis of, now you have hypertensive disease, coronary artery disease, because we
Mhm,
found the blockages,
mhm.
and you have congestive heart failure. You have three
Yeah,
diagnoses.
because my repeat echoes was still now, and this is what is so, and I understand why our patients are so frustrated, because I have a cardiologist who's had my echo done after the post stent, and they were giving me an EF about 35 to 40, which is still
So,
on that lower side. And then my cardiologist refers me, wants me to see the EP doctor, a cardiologist, which I see him.
mhm,
And he's like, well, because it's still 35 to 40, we want to consider putting in a implantable defibrillator.
that's right.
So then I'm like, okay, wait a minute. Wait a minute. Wait a minute. Okay, I'm dealing with this hypertension. I'm dealing with this. You are not getting ready to tell me that I need a defibrillator. I don't need a defibrillator
Well, you know why
because
you need one?
yep,
Why they tell you need one? You need one because of that low EF, and you get pooling of blood, right? And
right.
and that can trigger an arrhythmia that can be
Yep,
deadly. Period. Point blank. So
right.
you that is the protocol to save your life, ma'am.
Yes. It it is.
It's a,
But we agreed.
oh God, you can't.
We agreed, and I will do what I need to do, but we agreed that
Who's
what he's gonna
we? Who is we?
the EP cardiologist, he's like, I tell you
Patient
what.
refuses. Did he put patient refuses?
No, he
He put
didn't. He said,
patient refuses.
no, he
Stand
said,
up
I'm
Smith. What he say?
no, he said, since I'm borderline, and it really can depend on when they're who's doing the echo, whether they're measuring, like it's
Oh,
all so
oh,
variable.
oh, it's
So,
our fault.
but so so he says,
What?
we're gonna get you a cardiac MRI
Okay.
because that's a true. So I'm going, okay. But here's what's confusing. Then when I go back to my cardiologist, he's like, yeah, well, then when they do that, it's going to be higher anyway. So then you're not going to qualify for it. And I wouldn't say it's better than the echo EF. It's not more truer. And so now I'm like, okay, what is it? You sent me to the EP cardiologist. He's saying that the MRI is going to give me a better EF. Plus, it will show scarring or anything like exactly what's going on because it shows that soft tissue damage. So let's do it. So anyway, I'm going to be getting that done in a couple of weeks. And based on that, if he recommends that I get the defibrillator, I will get the defibrillator.
You're gonna behave.
I'm a behaved. I'm a behave. I just need you to, you know,
Has this been overwhelming?
extremely. Extremely. And I mean, I'm working with if I had to really change my life. I'm walking around, I've got all these alarms on my phone, alarms to remind me to take my medication for the daytime because once I get going, let me tell you what my job I'm going, I'm busy. I don't even eat some days, which is another thing that's not good. But so I have alarms to take my medicine. I
Okay.
have alarms to remind me, okay, in an hour, you need to get ready to leave because you got to go to cardiac rehab and you're going to do this. You're going to be there 3 days a week.
Mhm.
So yeah, because it was very difficult for me in the beginning and it's very overwhelming. And again, in my mind, that's those patients who have heart disease,
Mhm.
not me.
Well, let me ask you this. First of all, what medicines are you on? Share that with us.
So now I'm on the ARB. I'm on losartan. I'm on my Lipitor, Plavix, antiplatelet for the stents. Beta blocker is the beta, and
How are
that's
your kidneys? How are your kidneys?
my kidneys are good. My kidney function was fine.
So, um, are you cardiac rehab? That's very important. One thing we say about particularly Black patients after either open heart surgery or a cardiac cath
Mm-hmm.
that they are not participating in two things: cardiac rehab and
Mm-hmm.
also getting nutrition,
Yeah.
because a lot of people need to reform their diet
Mm-hmm.
and they need to reform their exercise, and this becomes a very heart healthy lifestyle, right?
Yeah.
They need to, and you are originally from Chicago, so you can imagine, that trying to reform some habits, although
Mhm.
you know you can cook. Oh my God, it's so good.
Look,
I
by
want to
way by
have
way of Louisiana, I'm from Chicago by
girl,
way of
look,
Louisiana. So
Louisiana, Chicago, you can cook and you like to cook and you
yeah.
have a family that you love to feed. And Kenny, I love this food. You know, I love your husband food. But the question is, the cardiac rehab. What is that? Like most people are like, what are you talking about cardiac rehab? What do we do in cardiac rehab?
Yeah, so we actually are, it's an exercise program. We are looking at, we are on different, they have about, probably about 20 different type of exercise equipments there, from the treadmills to the ellipticals to roars to bikes and all of those things. And what they do is when you go, they put the monitor on your EKG monitor. They monitor your blood pressure before exercise, during, twice in the middle, and then your post.
Mm-hmm.
They also do things as far as your nutrition education. It's amazing, but a lot of people don't know, but you don't know what you don't know.
Mm-hmm.
So they do that every Wednesday. So they pick a different topic and they educate on that topic.
Mm-hmm.
And the exercising is good because it shows us, it builds us back up to where we need to be. So you start off a little bit low at first because, some people can't walk as far. They don't have as much strength. For me, I did not have surgery. My chest was never opened.
Right.
So I'm able to do uh,
More.
really a lot more than some of the other people, but you
Mhm,
see them and they come and they get stronger and they
mhm,
get better,
mhm,
and it lowers your chance of having a a secondary event when you're doing those things. It's difficult because most of us don't take the time, and even with myself, I am like, you guys don't understand my job. You don't understand what I do. But I had to come to that realization. My job goes on. It doesn't matter. If I'm not here, I promise you they're going to have somebody else doing that job. And I had to put myself first. So
mhm,
that even means with my job, I leave. That's why I set my alarms. All right, getting ready to go. I'm out of here. I have cardiac rehab today. I make my appointments, I go to them.
mhm.
Whereas before, I would always set them off. I would put them off. And if I put off an appointment, it would be a year before I get back to it.
Did COVID throw you off your schedule? Was
Oh,
like 2 years?
oh, definitely, because yeah, and then you had those couple of years of COVID where nobody did anything. So, it was just difficult to get
Well, we
in.
worked. We're first responders, so I don't think that you took off. You didn't take off during COVID. You had to work, didn't you?
Oh, no, I worked, but you couldn't get to
Oh,
your appointments, you couldn't get
it
to
was hard.
places. A lot of the doctor offices, yeah, they were, yeah, it was extremely, yeah.
So, so the question is, when I asked you this before, mom's history. I mean, don't we have to always consider our family history? And did you consider that? I mean,
I knew that. So my mom, who has hypertension, diabetes, heart disease, has a defibrillator
I
and
thought
pacemaker.
did she have an autoimmune problem before? Is that, I thought she had an autoimmune thing.
She does, it's, one of those ones
Peripheral
that's called,
neuropathy, is that why she's on the cane? But I
yeah, she has what they called, it was called stiff man syndrome.
oh, yeah, 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 yeah.
Yeah,
Okay.
and back in the day that a lot of yeah. And yes, she does have all that, but
Not you, not her child. Not her child.
that's her. She's 80. I do better. My mom never exercised and she never did it. I'm like, I monitor. I try to monitor what I eat. I don't eat a lot of the bad stuff. I do have an exercise program, and she's old,
But your
not
mother wasn't
me.
always old. At
That's
what age?
true.
What age did you see a decline in her health? That's the question.
Yeah. Probably in her 60s.
And you are.
Yeah, but
You
I
know,
am, and this is just how crazy this gets.
Mhm.
Because again, I've taken care of patients for a long time, and a few years ago, a couple of years ago, I had a outbreak of shingles. Very mild case because I knew it, I saw it, I got on it really quickly, I
Mhm.
think, but very mild case. And I remember talking to my doctor, and he goes, "Did you get your shingles vaccine?"
Of course you
And
didn't.
I was like, "Shingles vaccine? That's for older people." And he goes, "Yeah. So I hate to tell you this, but you are now those old people. You're over 50. You are 55,
Oh, girl,
55." And he said,
I told
um,
her. But she
"Ma'am,
did.
you're 55."
The wrinkles, girl.
Yeah. Yeah, yeah. He's like, "You're 55." And I said, "Yeah, I am, huh?"
And you were supposed to get your shingles
Mhm.
and pneumococcal
Mhm.
vaccine.
Yeah.
Didn't do it.
No. But I get my flu shot I
Well,
get it
because
get my flu, and I got my COVID.
well, we've been in hospitals. We're first responders. That's
I
a no
got
brainer. Most people thought people were being bashful about them, and then I had to realize because I've been in a hospital setting like since college, I've always had to get some type of vaccine. But if you have not had to, that wasn't tied to your job,
yeah.
you really didn't think
You didn't
about
get it.
vaccines. You never
Yeah.
thought about getting any more shots
Mhm.
after you got out of high school and
Mhm.
maybe college, but
Mhm.
that was it. But
Mhm.
we have always
Mhm.
had to do that to go to work. And
Mhm.
so it was a natural progression to
Mhm.
do that. Did you get COVID?
I have not been diagnosed with COVID. No.
Okay, so so because
Yeah.
there was some thoughts that people who had some type of heart disease, that could have been a result of the virus. But I do think that what you tell is a story that we really have to work on, and that
Yeah.
is underdiagnosing of hypertension and explaining away symptoms.
Mhm.
I do not understand why the medical community, and this is Black doctors, white doctors,
Mhm.
period, look at Black patients who are presenting with numbers
Mhm.
up and consistently always want to withhold
Mhm.
hypertensive medicine.
Yeah.
And the idea is that 2017 they changed the number to 120 over 80 is being elevated. So
Mhm.
since 2017, we've said, hey, we need to kind of look at this a little differently. But the practice of giving hypertensive medicines
Yeah.
to patients, antihypertensives medications to patients, has not improved. And we have all these markers, we have all these what are the quality assurance markers,
Yeah.
but we still have under treatment of hypertensive disease, ignoring symptoms of chest discomfort, particularly discomfort. Notice I didn't say pain
Mhm.
in women.
Mhm.
Uh, there's been studies on that since 1997. I think it's a Schulman study that said, patient presents that looks the same.
Mhm.
They found that Black women, by and far, symptoms were explained away very quickly as GERD
Mhm.
or dismissed as some type of psychological phenom as opposed to a real
Real.
symptom, and would not refer them to cardiac catheterization.
Mhm.
That our rates of going to cardiac catheterization are the lowest.
Mhm.
So, I know you're a smart and an informed healthcare uh,
Mhm.
consumer.
Mhm.
Okay, others are not.
Mhm.
Still ended up with the same
Mhm.
dismissive narrative about your symptoms,
Mhm.
um, and you ended up having a cardiac catheterization,
Mhm.
and you now have to manage
Mhm.
your congestive heart failure,
Mhm.
which is, by the way, is can get improve. I think people I hope they hear that
Mhm.
that can improve, that
Mhm.
can that now for some people it cannot, but
Mhm.
in your case, uh, we can look for an improvement.
Mhm.
Is that what you're
Yeah.
hoping for?
Yes, that's what my cardiologist believes. They're just like, "Deneen, let's give it some time. Let's do this therapy. Let's, make sure you're taking your medications, and, modify your eating habits, your nutrition, and let's
How's
stay
the
the
weight?
course."
How's your weight? How's the weight?
The weight, I actually lost some weight. I lost like about 8 pounds. So I am still on that roller coaster of doing those type things and trying to stay away from these quick fad diets
Mm-hmm.
that
Mm-hmm.
we like because
Yeah, yeah. And so how much are you? So you're able to go back to work normally.
yeah.
You probably have to see a cardiologist how often now?
So right now they're quarterly. My
Quarterly.
next appointment's 3 months. Yeah.
Okay. Okay. All
And
right.
but after we follow up for this, we have to see about my cardiac MRI, and depending on what that shows, whether or not I need to get a
Defibrillator.
implantable defibrillator, then that will change the course a little bit. But yeah,
Okay. That's where we are.
that's
And you feel it, how do you feel, first of all, emotionally and then physically?
physically. I feel fine. Have gotten my strength. I feel fine physically. I think emotionally, it's just a lot. I haven't even begun to deal with a implantable defibrillator if that's where we need to go. I
Yeah.
mean, I'm kind of and again, you know me, but and I'm looking at him and I'm like, I can't have that big old thing. And he's
It
like,
ain't no
oh,
big
well,
old
we have
thing.
another one,
Mom,
and this
you
one is bigger.
it's
They have a new one and it's big. And I'm like, that's big. And he's like, but it's under your skin. And I'm like, what?
hello.
Yeah,
Denise, I'm
I
not
know.
even, yeah,
I
again,
know.
just
But the wonderful thing about this
what?
is you have, for me, I have people who really care about me
Who
and
love
who
you.
know me and people
Love
like you
you.
that will,
Who are
yes,
upset that we are even having this conversation.
yes, yes, who will, to tell me the real deal and say, you will.
You're gonna get it, girl.
And I'm like,
You know I got your husband's phone number, right? You know that,
yeah.
right? Penny, I'm
Mhm.
on my way.
Yeah.
But yeah, the reality is you do have a lot of people that love you and care about you, and you've been a super mom, you're a great grandmother, you've
Mhm.
been a super wife, a great role model.
Mhm.
Uh, and so, it's just stressing for the people around you. And we got to keep you healthy. I think that a lot of women can feel what you're feeling,
Mhm.
even along this trajectory,
Mhm.
trying to all of a sudden be hit with a healthcare crisis.
Right.
Really
Mhm.
what it is.
Yeah.
Whether
Yeah.
you're in business or
Mhm.
nursing,
Mhm.
and as we get over 50, whether it's cancer, breast cancer,
Mhm.
heart disease, lung cancer, something,
Mhm.
some people are looking at joint replacements.
Mhm.
The thing is we try to be as healthy,
Mhm.
basically spiritually and physically as long as possible.
Mhm.
So I think that honest talks like this, where you can
Yeah.
just say, this is how I was feeling, this is what was going on, but
Mhm.
it's not all on the patient. I mean, I think I'm running my platform to basically say, where can the patient and the doctor meet? Okay.
Mhm.
It's something that we're doing and it's something that you all are doing, right? So we have to figure out, how to better communicate. I think there's a lot of barriers. You said you saw a nurse practitioner, and luckily your nurse practitioner knew to take you to send you to the cardiologist.
Yeah.
So we have paraprofessionals. People say, I saw the doctor, and they're not. They're seeing a nurse
Yeah.
practitioner, they're
Mhm.
seeing a physician assistant.
Mhm.
That physician assistant or nurse practitioner, like I said, yours was good to say, you know what? I need to bump this up.
Mhm.
I can't, get inside and say if someone has a good nurse practitioner or physician assistant, but their role is to bump this up if they
Yeah.
feel uncomfortable or
Mhm.
uncertain with certain
Yeah.
symptoms. And patients need to know who they're seeing. I mean, because
Yeah.
it's like, well, they said I didn't need it. They said
Yeah.
I didn't need it. And then, of course, you go to the emergency room and it's a stroke or it's a
Mhm.
heart attack.
Yeah.
Or so that's the thing that's what makes it these things preventable.
Yeah.
That I mean, we
Mhm.
all have genetics and we get diseases.
Mhm.
But there's a prevention. There's a step in there where we could have intervened as healthcare professionals.
Yeah.
And one was when you got off that floor and said, don't come get me."
I know, right? I surely did. And they was like, "Oh, okay. Well, it sounds like you got it." And I'm like,
Oh, I did the same thing. I ain't gonna lie to you. I did the
I,
same. I did the same thing one time. I said, let's go, let's go, let's go. I don't need this. I don't need it. But
we're good.
yeah, we're good. So
I,
I'm gonna check back with you in 2 weeks. How
mhm.
many weeks before we decide what we're gonna do?
So March the 2nd is my appointment. Is my MRI, and then I follow up a week after that. So really probably about 4 weeks before I follow back up and get
Okay.
and decide what we need to do. But I haven't had any other syncable episode. I only had the
Okay.
one time.
Well, now that you've given Dr. K her chest pain, and I'm gonna let you go. Uh, I think that this has been truly informative, and I want
Yes,
to thank you for, like I said, being an outstanding friend, and we can get you taken care of and squared away.
yes,
And but thank you. I know that people will learn a lot from you, learn a lot from this conversation, and you've been the best. That's all I can tell you.
Well, I want to thank you because you have been the best. So, I know that you're always going to give it to me straight
Hmm.
up, right front in my face, the same way I did when you was at, young resident so many years
Get out
ago.
there.
So many years ago, I was like, come on, come on, come on.
That's right. Get out. Yeah. See my
And,
patient.
and that's what we do. And
Yes,
that's what we
we do.
do.
All
That's
right, my love. Thank you so much, Deneen. I'm gonna check back in with you and the family, and we're gonna get this shown onto the viewers, and we'll get you some good feedback. And you've saved a life. You really have. You truly have by ministering to other people out here, men and women, but especially women during this Heart Health Month. And we're
yes,
gonna check back in.
yes.
Bye.
All right. Okay. Bye bye.
Don't leave.